it's important that people have a screening colonoscopy because colon cancer is one of the most preventable cancers that you have. And the reason why it's so preventable is because it usually develops in a predictable way. For the most part, you start with a normal colon, then you move from that to developing a wart that we call a polyp. The polyp gets bigger, starts to grow what we define as autonomously. You can't stop it anymore, and then it grows into colon cancer. So if we can stop that before it gets to the point where it grows into colon cancer, we can remove that polyp at the time of colonoscopy. And that's actually one of the reasons why colonoscopy is the gold standard. It's the one we recommend the most because at the time when we see the polyp, we can get rid of it right then and there.
I'm 49 and have a slight history of cancer in my family, and I thought, let's go ahead and get the test, and then if I'm going to have the test, let's show people that it's not that scary. That actually it's pretty easy to do. You probably don't remember the parts you don't want to remember, and that the staff is great. So that's what we're doing.
For the most part, the reluctance to have a colonoscopy stems from the prep, not from the procedure itself, because you're sedated during the procedure, and most people don't remember anything about the procedure itself. However, the day before, we need to cleanse the colon of all the stool. And that's a little bit challenging. You have to stay close to a bathroom. People don't like that a lot. If you don't like the actual prep, we have no problem with your drinking the clear liquid of your choice, the ones you like, at the time when you're drinking the prep, just to make it go down a little easier. I'll have some sort of a conversation with them in what we call the pre-operative area. We'll go over what it is that we're going to do. I'll probably answer some questions that they or their relative, the driver, the person who's going to drive them home, may have. And then we'll talk about how I pass the scope on the left side of the colon, go across, and then go to the right side where the colon essentially starts, and that I come back very slowly and look in between the folds to look for those polyps so we don't miss them. And that's why the cleansing of the colon is so important, because you don't want to miss those polyps, especially when they're small, or more importantly,
markings on it here is it goes up to about 160 centimeters. We don't need all of that. We usually go up to about 90 centimeters when we get to the top. And it's like a fairly thin hose. There's a light camera system, which is based on a fiber optic display at the top. And if I just click this on here, you can see those lights come on. So whatever I'm looking at, we'll be able to see on that screen.
The goal is for the patient not to remember the procedure. We do the procedures two different ways. There are some patients that will do conscious sedation. So if I were to talk to you loudly and ask you to change your position, turn to the other side, turn on your back and so on, you could probably help me even though you couldn't do it all by yourself. There's some patients that will open their eyes from time to time during the procedure, but they'll have no discomfort. That's conscious sedation. Most patients are done that way. There's some patients that are done with anesthesia. For whatever reason, we think that they're going to be difficult to sedate. So we ask the anesthesiologist to take care of that. And they're a little more deeply sedated.
All right, give a thumbs up sign now, Tom. All right. So we completed the colonoscopy quite easily. He did not wake up during the procedure with any pain. There were a couple of areas that were difficult to get around, and so we normally just warn the patient about that, but he did great. And the findings were minimal, no polyps, no cancers, and he tolerated the procedure quite well. Colon was clean enough for me to get a good look, and so you don't need to do this again for another 10 years. All right? That good news?
It's great.
All right, man. Thanks for coming in. All right. All clear.
If you could do one simple test that stops you from getting colon cancer and probably saves your life, you should do it.